Hello, my name is Julia Solis, and this is my final research project presentation for HIM 5301 with Dr. Wang. The topic of my presentation is Standards and Security of the Electronic Health Record. There have been many changes in healthcare over the past decade. Some of those changes include the move from the paper medical record to the electronic health record. It's easier for providers to coordinate care with the use of the electronic health record, and there's easier access for the patients to their healthcare information with the use of secure portals that are established within each healthcare facility. Some of the concerns about the level of privacy and security of the documentation within the electronic health record include who can access the patient information within the EHR, and how is potential access granted to view the information within the EHR, and how is the documentation protected from loss, theft, or hacking. And what should a patient do if they feel that the information within their electronic health record has been compromised? Safeguards and privacy and security. State and federal regulations that have been implemented include the Health Insurance Portability and Accountability Act of 1996, also known as HIPAA, was implemented on April 14th of 2003. On January 25, 2013, the Federal Registrar published the Department of Health and Human Services Omnibus Amendments, also known as the Omnibus Rule, to HIPAA, Privacy, Security, Enforcement, and Breach Notification Rule. The American Recovery and Reinvestment Act, also known as ARRA, of 2009, was also implemented. Was a regulation that was also implemented to help with the privacy and security of patient information. The intent of HIPAA and subsequent HIPAA privacy and security rules is to keep patients' private information confidential while allowing providers access to and maintaining the integrity of the information for quality care given to the patient. There have been some initiatives for the move from the paper health record to the electronic health record, and some of these initiatives include a reduction in excessive paper trail, a reduction in cost, improved quality of care, the promotion of evidence-based medicine, and record keeping and the mobility of the health record. Goals for maintaining the security of the personal health record information within the EHR, confidentiality, which ensures the health information is accessible only to those who are authorized to access the information. Integrity ensures that the accuracy of the information is documented within the EHR. And availability, that the information is available to the healthcare provider when needed to give care to the patient. The security and privacy of the EHR has the threat of invasion by hackers, viruses, and worms, which enhances the privacy and security of the EHR. Some security measures that can be taken to assist in protecting the medical information include data encryption, access control, requirement of authentication and authorization, and pseudo-anonymity techniques. Many facilities have privacy and security policies in place for access to the EHR and are enforced. Methods that are established to ensure privacy protection can include encrypted devices, strong passwords, two-factor authentication, employee training on privacy regulations, confidentiality agreements signed annually, and auditing tools for the employees to determine if inappropriate access has occurred for their records. In conclusion to my research paper, in the healthcare industry today, the EHR systems are the primary application of modern technologies. Although the weaknesses are evident, there is significance related to the security and privacy given to the positive gain and geared to quality care that is dedicated to the patient. It has become a global concern in ensuring the security of the medical data that is transported electronically over the networks with the advance of information technology. Leadership, teamwork, flexibility, and adaptability are the keys to finding solutions. That is the conclusion of my research paper. The last frame on my PowerPoint presentation are the references that I used for this PowerPoint presentation. Thank you for your time.